Thank you. I'm lucky that everything went back to normal to make Copenhagen, Denmark, a happy place again. Okay, so my messages are the key messages from our society. So basically, what are the key messages for our mission and what is the European Society for Medical Oncology doing for helping on one side patients and the other side all the physicians to work together to get a better future today for our patients. So basically collaboration across different groups of interest is the key. And the key is not only medical oncologists but also surgeons, radiation oncologists, pathologists, pharmaceutical industries and health authorities and regulators to work all together for the best of our patients. And therefore, we need a truly integrated approach to cancer care that becomes basically patient care, with the patient at the center of it. And the Danish Cancer Plan in its fourth edition basically is really integrating all these efforts with only one goal, that is helping patients to live longer, to survive cancer, and also to avoid that people will become cancer patients. And then we think that this Congress, like we will do every year a Congress in Europe, is another opportunity to build together stronger relationship with all the professionals working together for the best interest of cancer patients. And therefore, local partners are of special relevance. And here in Copenhagen, in Denmark, we had a wonderful collaboration with our host, Professor Lassen, that is the president of the Danish Society of Clinical Oncology, as well as of the government institutions, as the Danish Minister of Health that will join us for the opening ceremony in 1 hour, and the Danish Cancer Organization, the Medicine Agency, and also the local regional governments and the Association of Pharmaceutical Industry. But what is integrated if it's not sustainable? You have seen that in melanoma, that this disease was a deadly disease as a metastatic disease until a few years ago. We have not followed the pace of knowledge in terms of care with effective translation to sustainable care in most of Europe, not only in former Eastern Europe. And so the ESMA Congress is the most important time of the year when all the efforts we do in research, that's why it's very important help by you, by the press, to give our message throughout the real world, to inform that we can offer a lot in terms of diagnostics, in terms of integrated therapeutics approaches to our patients, but we need to work in a way that this is sustainable, because we don't believe that cancer treatment is only for very few rich and fortunate people. We believe that cancer that is an epidemic worldwide should be treated as an epidemic, and all patients should get the best treatment, that all patients should be accessing the best advanced treatments wherever they live. So this is a rapidly changing landscape, and it's very important to bring it for the next few years. That's why this is the 2020 vision of the society, to integrating cancer research more and more in the diagnostic and treatment pathways. And therefore, a congress like ours is very important for the growing importance of specialized education. We will have about 20,000 attendees here, and they will come here to learn more, to get more information, so to go back to their hospitals, to their centers, to bring to the patients what they have gained here in terms of knowledge. And again, this should be sustainable cancer care. Obviously, research is bringing new pace of knowledge, is bringing new frontiers, but they will have no effect if they cannot be translated for all human beings when they become cancer patients. So this is really the vision and the mission of ESMO, to do whatever we can as a professional society to bring together all the expertise that is necessary, to discuss about the latest achievement in cancer research, diagnosis and treatment, and bring back to our patients. And again, to welcome you again in Copenhagen for our Congress for the next few days. Your help is essential to bring the right message to the people. You know, in oncology, you can be either very skeptical or pessimistic, or maybe you can present data with too much enthusiasm and optimism. We would like to find the right way to present the latest development that will be presented in these days in our Congress in the best way to the general public worldwide. And we need your cooperation for reaching the people worldwide with the right message. Thank you to be here.